Good afternoon. We're going to give everyone just a minute or two to get settled into the Zoom, but welcome to Financial Inclusion 101. All right. In the interest of time and everyone who was on time, we will begin. So again, welcome. This is the first in a four-part series for financial wellness for people with disabilities. Today's topic is Financial Inclusion 101. My name is Becky McDicken, and I am joined today by my colleague, Katie Metz, who you will meet in a moment. Next slide. This project is part of the Inclusive Healthy Communities project in New Jersey, which is part of the New Jersey Human Services Division of Disability Services. So we thank them for their generous support in allowing us to offer this series to you. Next slide. So my name is Becky McDicken. I am a Director of Financial Empowerment at the National Disability Institute. And as I said, my colleague Katie Metz will be joining us in a little bit, unless Katie wants to say hello now. But we will just continue on for right now. You'll meet her shortly. And I will take care of the housekeeping first. So next slide. We have ASL interpretation arranged for this webinar. There are two interpreters, and they'll be switching off throughout the event. To view ASL interpretation, please navigate to the menu bar at the bottom of your screen and click Interpretation. Select American Sign Language to view the interpreters in a separate video pane. Next. For audio, if you are using your computer, please make sure your speakers are on or your headphones are plugged in. We have all made those mistakes before. But to call in for audio, if you're not using your computer, please dial 1-877-853-5257. And our meeting code is 894-456-24074. Real-time captioning is being provided as well, and the captions can be found by clicking the CC button in the Zoom controls at the bottom of your screen. If you don't see captions after clicking that button, please alert us via the Q&A box, and we will see if we can assist you. Next. For any questions throughout today's presentation, please put them into the Q&A box. We will do our best to address them either at that moment or towards the end of the presentation when we've saved some time for questions. If your question is not answered during the webinar, or if you're listening and can't put the question into Q&A, you can email Kish Pisani, which is KPISANI @ndi-inc.org. Please do note this webinar is being recorded, and we will have the replay up within 1 to 2 weeks on our Financial Resilience Center website, and that link will be provided to you shortly or in the chat. Next slide. If you're not familiar with NDI, we are a national nonprofit organization dedicated to building better financial futures for people with disabilities and their families. We are the first national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for persons with disabilities. And we're celebrating our 20th anniversary this year, so we're very excited about that. A few of the things that we do, we are building capacity of the field through training and technical assistance. What does that mean? Well, we go out and train individuals who are working in the disability space to be more inclusive, to understand the nuances of a person with a disability, especially when it comes to their financial empowerment and those types of issues. We drive systems change by implementing models that can be replicated from city to city or state to state. And we're very proud of some of the work we're doing, including this program here. We are testing innovative approaches to financial empowerment by training trainers, by doing other resource mapping and other types of events as well. We have researchers on board who are working very hard with the research to uncover barriers and opportunities for people with disabilities, where there are more opportunities for exploration and how we can get into certain spaces and improve people and their situations. Lastly, we advance change through public education and policy development, and our policy team is very busy in days of late, but we are working behind the scenes nationally as well as regionally and in certain cities. So with that, next slide, please. We're going to kick off with a real quick poll just to find out your level of familiarity with the concept of financial inclusion for people with disabilities. So you've got the Zoom poll popping up, and 1 is not familiar at all, up to 4, which is very familiar, and obviously slightly familiar and somewhat familiar are in the middle. All right, if you could just pop in your answers, we'll give you just a few seconds. All right, we've got a very good mix of people coming in on this poll as far as where you are, and hopefully by the end, everyone will feel much more confident about this topic. I think we can end the poll at this time. And we can move on to the next slide. So, as I already mentioned, this is Financial Inclusion 101, brought to you by the Inclusive Healthy Communities Project through New Jersey's Human Services Division of Disability Services. Next slide. Our agenda for this afternoon, we're going to talk about some statistics specifically to New Jersey. We're going to talk about the ADA, Americans with Disabilities Act. We're going to define some terms for you today, including financial inclusion, financial wellness, financial education, and financial capability. And yes, there is a difference between all of those. We're going to talk about NDI's financial capability indicators, and lastly, some other upcoming training opportunities for you. So with that, let's get into the meat of the project. So to start off with some statistics, which makes it so relevant as to what we're doing and why it's so important. In New Jersey, according to the U.S. Census Bureau in 2023, 11% of the population has reported a disability. 8.2% of working adults have a disability in New Jersey. And you'll see on that third bullet, 28.7% of adults with a disability are employed, compared to almost 69% of those people without a disability. So we can see right there that someone who has a disability may not be able to find employment, and it's not for a lack of wanting to. We need to break down some of those barriers. So that's one of the reasons we're doing this type of training. The median household income in New Jersey for someone with a disability, $86,700, but without a disability, you see it's almost $120,000. So a big disparity there. 19% of people in New Jersey with a disability are living in poverty. And we want to make that a lower number. And lastly, 14% are receiving supplemental security income or SSI. So we want to help people recognize how they can utilize the benefits they are receiving, but perhaps increase their own income with work supports, et cetera. We'll get more into that over the course of this. The census data is there. The link is at the bottom, but there's one other link there, the best and worst states for people with disabilities. When we send out the slides at the end of this, you will get the slides, and the links are all live. That link is it's fascinating to compare New Jersey with other states. New Jersey is actually ahead of the curve on a few of the issues that are measured in that study or on that site, but definitely take a look at it. It's fascinating. So I will get into a couple of the things in a minute. Next slide. So some other things about New Jersey, the prevalence of disabilities and the different types of disabilities. For every disability type, we're looking at about, again, 8.1%. This is 16 to 64 age group. Visual disabilities is 1.9% of the population. Hearing is 1.3%. Ambulatory, 3%. Cognitive, 3.7%, self-care disabilities, 1.3%, and independent living disabilities, 3.2%. Now, obviously, somebody might also have more than one disability, so that's why those bottom numbers don't add up to the 8%, but we can see that there is a large portion of individuals in New Jersey that need some, maybe some extra assistance in getting to work, et cetera. And we want to help with that financial empowerment piece. Next slide. So another thing we've discovered, households headed by a working age person with a disability tend to use alternative financial services more. We've actually seen the numbers come down, at least between 2013 and 17. Those numbers are coming down due to education and proper us getting the word out that some of those services aren't the best things out there, the best products. And what we're talking about is check cashing, money orders. Why aren't those good products? They may work for somebody, but we need to be aware of the additional costs associated with those things. It may feel like it's just $1 here, it's just $1 there, but those things add up week after week, month after month. And we highly encourage people to get banked with a financial institution, so they don't have to use those alternative services. But we have found that households with a disability tend to have a 28% usage rate of those alternative services compared to households without a disability at 19%. Now, the second bullet is all about saving for emergencies, saving for those unexpected things that happen to us when life does happen. 39% of households with a disability are trying to save for those events, but compared to 63% of those households without a disability. Some of the reasons for that are those associated costs with a disability that ends up costing someone more money. They can't save as much. We want to change some of those things. We also see the statistics that people who have a disability are more likely, if they are saving, to give that money to keep it home or give it to a family member instead of putting it in a checking or savings account. And you can see the numbers there on the screen. 18% versus 10%. So we want to change that. We want to keep those numbers coming down. So we're working to, spread the word and give more education. Next slide. Now, the American with Disabilities Act was passed back in 1990. And one of the things that it promised is, you can see the quote here, the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency for such individuals. When the ADA says it, we want to make sure we're following through with that. And that is one of the biggest pieces of our mission here at NDI, is making sure that piece is in place. Next slide. Actually, I think we have a poll again, a quick poll. Seeing who's paying attention here, which ADA goal is most closely connected with financial inclusion? Let's pop that poll up. Is it medical treatment, charity and assistance, independent living, and economic self-sufficiency, and education only? And look at you. Thank you. All righty. So yes, thank you for listening. Coming to my TED Talk. Can we move on to the next slide then, please? All right, so financial inclusion. When we're talking about including individuals with disabilities, this is the availability and equality of opportunities for people to have useful financial services that can help someone meet all their goals and be able to plan accordingly for their future. But we can break that down a little further. Next slide. For people with disabilities, sometimes the definition has broader implications. So, for example, that first bullet, access to financial products, programs, and services that are usable, appropriate, and secure. What do we mean by that? Just because somebody has an online bank account, we know that there are other things that need to be done to keep that safe. But there are other products out there, again, some of those alternative services that aren't as secure. And we want to get the word out about what is appropriate as far as traditional banking, et cetera, and make sure people have access. The next bullet is access to pooled savings and opportunities such as ABLE accounts. And I'll stop there to pause and say an ABLE account stands for Achieving a Better Life Experience. And these accounts are a way for a person with an disability who had the onset of their disability before age 46. It allows them to save money in a secure account up to $100,000 in some cases beyond at different states, but it allows them to save, and that money is not counted against means tested benefits. So you can save that money and actually have a secure future. There are also obviously special needs trusts and pooled trusts. So those kinds of tools can be very helpful. We'll leave those to the lawyers for right now, but know that they are out there as a tool that can be used to help build wealth and opportunity. The last thing is access to financial coaching and counseling programs where the counselors understand all the nuances of a family that has a disability. And we have a training program that does that as well, but we want to make sure people understand all about the service system itself. And that includes those public benefits that people get, the programs that they're involved in, and then resource limits. It's so important that individuals understand those. And counselors need to understand that so they can appropriate counsel their clients. Next slide. So we said at the beginning, we're going to talk about the definitions. So financial education. I actually did financial education for the better part of 20 years of my life. But financial education is delivering the information to people that gives them the knowledge to make better choices, the skills that they will need. So what are we talking about? I can tell you, you should open a bank account. The question is, are you going to do that? Understanding why being banked for, and I'm using this as an example, but why being banked is so important, that it's safer, that it costs you less money. You can have that information, but it's that next step, taking the positive actions that makes, the financial capability. It gives you the ability to go make that choice, take that action, and open that account. There are so many other examples of that in financial education, to capability, but I'll stick on that one for now. Financial wellness is then the outcome of that capability. So you've opened a bank account. What is the outcome? Well, you now have your money in a secure FDIC insured account where it's protected, it's safer, and maybe you can save more money. Maybe you've got access to other banking services and products. So the outcomes may give you more tools and resources and help you approach that continuum and get more financially fit. So your outcomes are more positive. Next slide. So in New Jersey, I would like to mention this. You all have had a personal finance requirement for high school students since I think it's 2009. Every high school senior must have 2.5 hours to graduate, minimum, to graduate high school of personal finance. This is huge. Not all states have that, so you are already ahead of the game. If you are interested in learning more about those personal literacy statements, what's the word I'm looking for? You can go to the link and see what the public education system has. So to support that path of post-secondary success, we want students to have the knowledge and the opportunity to understand how they can develop both career awareness and then that personal literacy. Because work is definitely linked to earning money, making money, and saving money. Excuse me. New Jersey students, because of these credential requirements, will have that necessary knowledge as they graduate and come out into the world and start working in order to achieve their own personal success. So again, kudos to New Jersey. When we talk about money management being so important and why this should be a requirement in every high school across the country, in my opinion, this includes budgeting. We're talking about being able to create a basic household budget and live within your means. We're talking about building and maintaining a positive credit profile. We're talking about understanding what loans and debt can do to somebody's life and planning for those things, paying down debt. We will also want to talk about identifying and managing risks when that comes to your personal information, whether it comes to other scams and frauds that are going on. We're paying a lot of attention to the news and the latest things there. And understanding investments and insurance is also key to someone's financial well-being. So making sure we provide the tools and resources so that somebody can get that knowledge and then take action, again, moves them down that continuum to financial wellness. There are some additional resources, again, in these links that are being put in the chat as well, and you'll get the slides again later on. Next slide. So financial capability, it is the combination of knowledge and skills that helps somebody make informed choices and decisions and influences their behaviors. It's an opportunity to improve somebody's financial wellness and manage their financial resources. If you are working with clients, for example, it's a great opportunity if they say, hey, I finally got a job. And you can have that touch point and say, so what are you doing with the paycheck? And maybe open up that conversation and have some of those resources for them. For persons with disabilities, there are additional considerations that need to be made to ensure they're getting that opportunity. Personally, I am the mother of a young man who has autism, and in his IEP at school, he has financial education added in there. While the schools will stick with, I live in Pennsylvania, by the way, as well, so I don't have the same requirement, although it's coming that way. We made sure in his individualized plan that we said we want to make sure he's got financial education. The schools have a certain requirement or base levels that they have to meet, but as a parent, if you're out there, please make sure that you're including that in your kid's IEP. It could really help them in the future, and we want to be preparing them for independence as best we can. We want to make sure they're aware of the right to free benefits and counseling and of those services that help them manage those benefits if they're receiving SSI, SSDI, and other things. People can benefit from the exposure to opportunities to learn those money fundamentals and management. Take them to the store, make sure they know how to use a debit card or that credit card, and explain when the bill comes how it works. So we can all be doing that. But money management includes learning those sound steps, those building blocks we need to learn, and take steps towards increasing income, growing savings, and through investing and developing long-term assets and resources. All right, next slide. So financial capability and the rights. So financial capability is defined first and foremost as the ability to manage financial resources effectively, but people also need to understand they have the right to do certain things to meet that. And as they get to know what their income is. We've dealt with, families where maybe somebody, they've got a child with a special needs working, and they don't know how much they're actually making. There's no conversations going on around it. They have a right to know what their income is. They should know what monthly expenses they have. And this is going to prepare them when they're moving out on their own. And again, I'm thinking of my own son at this point in time, but we want to know what expenses we have and talk about those. We want to tell our clients, our kids, whoever it may be, where they can save money regularly and be prepared for that future, for those emergencies. We want people to know how to read their monthly statements and calculate the total costs of using their credit to secure assets, whether it's the right choice to use a credit card or not this time kind of conversations. So we're looking for all those opportunities and making sure individuals have meet those rights. So next slide. So some of the desired behaviors and actions that move them along that continuum, we want everyone to earn money. Individuals with disabilities are sometimes thought, oh, they're probably not going to work, and maybe they want to work, or maybe they're not getting to realize their full potential, and they don't understand that there are work support programs out there. But everyone should be able to work if they want to. Individuals should be able to utilize their money and to meet their own needs and their goals, to pay bills on time, and utilize affordable products. And they should be able to spend less than their monthly income. I know that setting a budget is not always the fun thing to do, but we want to spend less than what's coming in, as opposed to spending more than we have. We want everyone to save. Again, pay yourself first. That's a great rule of thumb, is always put a little bit away in savings. Have that emergency fund in place for those unexpected costs, and use match savings programs when possible, and other protected savings assets or savings opportunities such as an ABLE account again. We all need to have easy access to liquid savings. If that emergency happens, you don't want to be taking time out to, sell property or stocks and bonds in order to, pay for a new water heater. We want to try to have, that cost put somewhere in a savings account. We want to be able to save those for those long-term goals and plan for the future. And then we need to protect money. We need to understand and make sure people understand, don't give anyone access to your personal information, social security numbers, all that. We want to protect them. We also want to make sure we're working and investing so we can our money can earn us more. We want to use credit wisely and pay our credit on time and build that good credit score. And lastly, understanding money, just again, using the basic idea that somebody has a concept of money and we can work with them, depending on where they are, to understand the concept of money, what kind of entities to use and trust, and other available resources and supports. Right here on the slide at the bottom, we have a survey from the Financial Health Network. It is a wonderful tool if you or a client, depending on who you are, want to assess where somebody falls on their financial wellness scale. They have a great tool there. And I also know the Consumer Finance Protection Bureau has one as well. And I don't think we prepared that link, but I'll get that. I'll get that while Katie's talking. So anyway, next slide. So speaking of Katie, I believe it is time, and she's going to come on and introduce herself and do a little bit about our financial capability indicators. Katie?
Thank you, Becky. So it's a pleasure to be with you all today. As Becky mentioned, my name is Katie Metz. I'm the Director of Financial Inclusion Strategies at NDI. I've been with NDI for close to 15 years, and part of that, I work in the Mayor's Office for Persons with Disabilities. So it's really a pleasure to get to know and meet all of you. I'll start off. We're going to talk a little bit about our financial capability indicators at NDI. So let me pull it real quick. Excuse me. There we go. All right. So as Becky kind of just walked us through what financial education and financial capability looks like in practice, right? Earning, using, saving, protecting, and understanding money in ways that support real goals and day-to-day stability. We're going to focus too on how we actually help people get to financial wellness. And that's where our financial capability indicators for people with disabilities come in. These indicators were developed to reflect the real lived financial experience of persons with disabilities, including public benefits, healthcare costs, employment barriers, and asset limits that traditional financial education can sometimes often overlook. These indicators really serve as the foundation for how we work to prepare people with disabilities to be more financially self-sufficient through webinars like today and through our Train the Trainer approach, which you'll hear more about. We really want to help educators and service providers move from good information to meaningful outcomes. So before we dive into financial, each individual educator, on the next slide, I'm going to take a look, and all of us together, to step back and look at the framework as a whole. So these 10 financial capability indicators represent the core areas that support financial wellness for people with disabilities. Together, they really reflect a full financial picture, from earning and managing money today to planning and saving for the future. What's really important to note is that these indicators are not meant to be linear or one size fits all. People may enter this framework at different points depending on their life stage, disability, their employment status, their benefit situation, and that flexibility is really meant to be intentional. I do want to pause there 1 minute because as you'll hear throughout the presentation, we will talk several times about individuals who may be on public benefits and how that impacts them. But I also want to recognize that not all persons with disabilities receive public benefits. So I'd just like to make that little disclaimer as we're talking about things. But certainly those who are individuals who are on public benefits often have extra barriers that they might have to overcome. So as we look at these indicators, we really look at them as a practical roadmap for individuals, trainers, providers, community organizations. They help us move beyond abstract financial education, which is important, but also focus on the real decisions that people are making around income. Again, benefits, health coverage, credit, savings, which often have very complex systems. So we're going to walk through each of these indicators briefly, starting with the foundation for all financial wellness work, how we set and achieve meaningful financial goals. So no matter where someone starts, everything we do within this framework is guided by the individual's own goals, which is why goal setting comes first. So on the next slide, you'll see where financial wellness really starts with that goal setting I just talked about. Goals may be big, they might be small, and they certainly will change over time. For many people with disabilities, goals often include stabilizing benefits, savings for emergencies, increasing independence, or preparing for work or life transitions. We really encourage financial goals to be part of person-centered planning. And what do I mean by that? For example, that can mean including financial goals in an individual's plans for transitioning out of school, transitioning out of foster care, secure remaining employment, or moving toward independent living. Whatever an individual's goals might be, that's what we want to work to for them on their financial goals as well. Because when we lead with someone's own goals, and then when the individuals identify those goals themselves, track their progress, we consistently see stronger engagement. We see positive behavior change and more sustainable progress as we go through. On the next slide, we'll talk about increased income. So goals are about what matters most, but they also raise practical questions about income and stability. And know that conversations about work and income can bring up a lot of questions, sometimes stress, sometimes worry, especially when public benefits are involved. So at the same time, employment and earned income are central to financial stability. A paycheck is how most people pay for everyday needs, right? Like rent, groceries, utilities, transportation. So without reliable income, it becomes much harder to stay current on bills and plan for the future. A key message we emphasize is that working more does not automatically mean losing benefits. Through Social Security work incentives, which you will hear more about later, and accurate benefits counseling, as I just mentioned, we'll talk about that more in our March webinar, and you'll actually get to hear from some of the local New Jersey experts as well. People can often increase their earned income while maintaining essential supports like healthcare. This is a critical financial inclusion message. When people have the right information, the right supports, work can really be a pathway to greater stability, independence, and choice, not something to be feared. That's why the next indicator focuses on understanding and managing public benefits. So people have the information they need to work, earn, and make decisions with confidence. Next slide, please. Public benefits often provide an important financial foundation, but navigating them can be really overwhelming, right? And that's been your experience. You're not alone. Financial inclusion means making sure people understand how benefits interact with their earned income, with their savings, so that the decisions that they do make don't feel risky or confusing. So here in New Jersey, we will work to connect you with certified benefit planners who can help explain work incentives, maximize available supports, reduce that fear around earning and saving. As I mentioned earlier, during the March webinar, you'll hear directly from New Jersey's work incentive experts who can walk through these supports in more detail and will give you their contact information for individuals who qualify for their services. Because health coverage is often one of the most important benefits people are really trying to protect, the next indicator focuses on specifically managing affordable health care. Next slide. So as we just talked about, Public benefits play a major role in financial stability, and understanding how those benefits work really matters. When people understand public benefit rules and know how to use available work incentives, it creates opportunities to increase earnings and savings while still maintaining one or more benefits. We often hear from individuals that while their cash benefits are really important under public benefits, sometimes their healthcare benefits are even more valuable to them. So, healthcare coverage is often one of the most important benefits they're really trying to protect. Access to healthcare is closely tied to financial wellness. Also, medical debt is a common source of financial stress. This indicator focuses on helping people make informed choices around Medicare, Medicaid, and other available healthcare coverages. We look at ways to manage coverage so out-of-pocket costs are more predictable and financial risk is reduced. When healthcare costs are more manageable, it becomes easier to stay on top of everyday expenses, which really brings us to the next indicator, managing monthly expenses and debt. Next slide, please. As we think about income benefits and financial decisions people are making every day, the next indicator focuses on managing monthly expenses and debt. So here in New Jersey, it's a real and growing challenge as it is all across the country. In around mid-22, we see that about 42% of New Jersey residents reported difficulty, paying basic household experiences. And by 2023, that number had risen to nearly half of all residents. Many people are really doing the best they can with limited resources. For people with disabilities and those on fixed incomes, plus disability-related expenses, this can make this even harder. This indicator focuses on practical tools that help people manage expenses and pay down debt in ways that feel doable and not overwhelming. Looking ahead, we will dive deeper into those tools during our upcoming Train the Trainer session this fall. Those trainers will be equipped with strategies like spending diaries, monthly spending plans, so that they can truly support people across New Jersey in helping them track expenses, reduce stress, and aligning spending with their needs, wants, and financial goals. When people have support to plan ahead and manage expenses, they're better able to stay current on their bills and really feel more in control, which naturally leads into the next indicator, which is managing credit. Next slide. Once people credit can affect access to housing, employment, and transportation, and many other things. Yet many people with disabilities avoid credit or often discouraged from using it out of fear of predatory practices. When people are discouraged from engaging with credit altogether, they can become what we call credit invisible, which then can limit options even when someone is being financially responsible. For us, financial inclusion means creating safe pathways so that individuals can build and manage their credit. Credit doesn't mean taking on debt, it means having options. And because credit can show up in places they may not expect, the next slide looks at how credit reports are sometimes used in employment here in New Jersey. Next slide. So, as we just talked about, credit can affect more than loans. It can also show up in places people don't always expect, like employment. So, this slide connects credit directly to real life outcomes, jobs. In New Jersey, employers must follow the Fair Credit Reporting Act, which means that they have to give your permission before checking your credit and providing notice of credit information, and if it's used in an employment decision. Knowing these protections can help you ask questions, understand your rights, and truly advocate for oneself. It also reinforces why having access to safe ways to build and manage credit can expand employment as well as housing opportunities and other ways of saving. Because the way credit is built and used often depends on the financial products people have access to. So the next indicator focuses on selecting and managing financial products and services. Next slide. Having access to safe, affordable financial products really does matter. Banks, credit unions, prepaid card services, they all offer a range of financial options designed to meet the needs of people at different income levels and life stages. This indicator really focuses on helping people choose financial products that are affordable, transparent, and appropriate for their situation, whether it's a checking account, a savings account, or another tool for managing money safely. When people have access to the right financial products, it becomes easier to receive income, pay bills, build credit responsibly, and avoid high cost or predatory services. But we also know that not everyone has equal access to these options, which brings us to the next slide and what national data tells us about who is and who is not connected to the banking system. Next slide. So see here, national data shows progress, but it also highlights the ongoing gaps for people with disabilities. In 2023, working age households with disabilities made up 21.5% of all unbanked households. Unbanked, of course, means those individuals who are not using any type of established traditional financial institution. And that number is down from 26.9% in 2021. So we are showing that there has been improvement over time. But looking at the long trend, between 2009 and 2023, the unbanked rate for working age people with disabilities declined from 18.3% to 11.2%, a greater reduction. So we know that the barriers still remain for persons with disabilities, and that households with disabilities are more likely to be without a bank account or to rely on limited banking options. And they're less likely to use mobile banking, more likely to have trouble accessing traditional credit. So this data doesn't tell us that people are doing something wrong at all. It just helps explain why access, trust, and accessibility matter, and of course, financial education. And that's also why we continue to focus on inclusive financial systems, accessible banking technology, and truly trusted education. Because access to safe banking is often the first step towards building savings, the next indicator focuses on planning savings for the future. Next slide. So again, access to safe banking and financial tools is often the first step towards being able to save. At the same time, many people have been told directly or indirectly that they can't save because of public benefits. That message creates a lot of fear and can stop people from planning for their future. This indicator is about challenging that fear. There are savings options designed specifically to help people with disabilities plan for the future, including options that allow savings without automatically putting certain risks, certain benefits at risk. Saving can look different for everyone, and every amount counts, right? The goal isn't perfection; it's having options and a sense of security. To get a sense of what people already know about these savings options, how about we take a quick poll? So on the next slide, and you'll see a poll pop up. Which savings option may allow people with disabilities to save without affecting certain benefits? A, traditional savings accounts, B, credit union account, C, ABLE account, D, career counseling, or E, none of the above. I think we're about halfway through participation. I'll give it another second. If anybody else wants to chime in, you're also welcome to put in the chat. All right. So either you're paying really good attention and read on the slide before, or you all know about ABLE accounts. The majority of you did say ABLE accounts, which is correct. This question kind of helped us surface a common myth that people who receive means-tested benefits can't save at all or will automatically lose their benefits if they do. And that's not true. This savings options, ABLE accounts, may allow people with disabilities to save without affecting certain benefits. So ABLE accounts were created to allow individuals who qualify to save for disability-related expenses and future goals without automatically jeopardizing their benefits. It's also important to note that ABLE accounts can be a good option for many individuals who qualify, even if they are not currently receiving public benefits. And for some people, that's just planning ahead and having flexible savings options. We'll take a deeper dive into ABLE accounts again during our Train the Trainer session in the fall. Those trainers will be equipped to share clear, accurate information about ABLE accounts and other savings options across New Jersey, which leads directly into the next indicator because having access to tools like ABLE is only part of the picture. The next indicator focuses on increasing financial knowledge so people can understand their options and make their own informed decisions. So, as we talked about savings, benefits, and financial tools, it becomes clear that none of this works without access to clear, trusted information, which brings us here, increased financial knowledge. The reality is that many of us, not just people with disabilities, have had limited exposure to practical financial education. Many people have never been taught how to create a budget, open a checking or savings account, apply for a loan, or build assets over time. For people with disabilities, those gaps are often made wider by systems that weren't designed to be accessible or inclusive. So while New Jersey, as Becky mentioned earlier, does require financial literacy instruction in schools, many people still need additional disability-informed supports during key moments like transition planning, entering the workforce, adulthood. That's exactly what the New Jersey project that we're working on will work to strengthen over the coming months, expanding access to financial education that is practical, accessible, and relevant to real life. Because information alone isn't always enough. The final indicator that we'll go over next focuses on something just as important, having trusted people and resources to turn to for guidance and support. So on the next slide, so we have solidified that information matters, but information alone isn't always enough. Most financial decisions aren't made in isolation. Who we turn to it for advice, who we make decisions with, and which systems we trust can truly shape our financial choices in real and lasting ways. NDI data shows that 36% of working age adults with disabilities were not taught how to manage their finances by a parent or guardian and were not offered financial education through school or an employer. That gap helped explain why trusted guidance matters. Without access to reliable information support, people are more likely to rely on high cost or risky financial options, not because of poor choices, but because safer options and guidance aren't always accessible. This indicator focuses on building a circle of support chosen by the individual that can include family members, peer support, service providers, financial counselors, or trusted community organizations. We believe people should have the right tools and clear information to make their own financial decisions with support from trusted, disability-informed sources when they want it. When people are equipped with the right knowledge, they're surrounded by trusted guidance, they are better positioned to make decisions that support their own goals and their long-term stability. Which brings us to the closing reflection on how all these indicators work together. On the next slide, as we kind of wrap up the discussion of the financial capability indicators, it's helpful to look at them together. Financial wellness is not about a single action. It's not about a single decision. It's about creating inclusive systems that allow people with disabilities to earn, to save, to protect, and grow their money over time. These indicators reflect that real financial decisions people are making every day around income, around benefits, health coverage, expenses, credit, all of it, and trusted support. They also remind us that this work isn't meant to happen in isolation, that people with disabilities, caregivers, service providers, community partners all need opportunities to learn together, share information, and support one another. They really form the foundation for the learning and the capacity building work we're trying to do across New Jersey, including the additional trainings and resources that will follow this session. That's why today's session is just the beginning. This is the first in a series of 4 webinars designed to help people start or continue their journey toward financial wellness. So with that, I'll turn it back over to my colleague Becky, who will walk us through the upcoming opportunities to learn more, including where this session kind of fits into the broader webinar series and what's coming next. Becky.
Great. Thank you so much, Katie. So Katie and I will be doing some more webinars. Next slide, please. We've got 3 more webinars coming up, and they're about a month apart. So next February 25th, we are doing the 5 key strategies to achieving financial wellness. Then in March, we're doing a review of benefits from Social Security Administration, and we have a New Jersey guest speaker for that presentation. We're very excited. And then the last of the webinars is extra costs of living with a disability and dispelling some of the myths that people with disabilities are subjected to every day. So we're looking forward to that webinar series. If you registered for this one, you are probably already registered for the other three. It does not mean you have to attend, but we would love to see you back, obviously. And then the next slide, even more exciting, Katie alluded to this a few times. We have a live in-person Train the Trainer event coming up. We don't have the date solidified yet, but we're looking at mid-September of 2026. Katie and I will be in New Jersey to do a free 3-day in-person, I'm going to clarify that, Train the Trainer event. It's designed to help individuals working with people with disabilities, family members, professionals, any self-advocates, understanding how, people can become more self-sufficient, less dependent on benefits, build a better financial future. Every day we provide lunch on those events, and then again we're waiting to determine the exact location and date. But they are 3 full-day trainings in person. No, there is not a virtual option as well. If you are interested in learning more about that, when we have the date and time and place solidified, please fill out this interest form. It will capture your information. It's simply your name and email and who you are, where you're from, or what your role is in the disability community. But you can fill out that interest form, and then when we are ready to open up our application process, we will get that out to you. So please do. That's been put in the chat as well, that link. So sign up for our exciting 3-day training. Next slide. Oh, I think we're coming to our final polls. Please don't leave yet, because we'll open this up for questions as well. But we'd like you to answer these 3 poll questions about this webinar today. You'll notice that one of them is very similar to the first question, which is, how familiar do you now feel with the concept of financial inclusion? From 1 being not familiar at all up to 4. And the second question is, which strategy do you feel most confident in supporting after today? And the Zoom poll is up. And then lastly, after the webinar, how would you rate your understanding of financial inclusion and financial capability? And when we've got the poll answered, we'll open this up for any questions you might have for me and Katie. But right now we're getting our answers in. This is great. All right, looks like the activity has ended, and we've got a mix of answers. So everybody got something different out of some of the most confident strategies you're going to use moving forward. So I'm going to end that poll if everybody's finished, and we can open this up for questions. Next slide. Yes. Any questions from anyone? You can type them in the Q&A.
It looks like Halisa,
Oh.
hopefully Cooper, has their hand raised. You are welcome to speak if you like.
Hi, sorry, I could not find the mute button.
Yeah, no worries.
It's pronounced Jaleesa. Thank you guys so much for this webinar. Very informative. I just had a question regarding the link. I didn't see it in the chat where we could, I guess, register to find out when the dates of the in-person training will be.
It looks like it's in the chat under, it's one of the last 2 things put in there, the interest form.
Let's see if Kate or Shelby can send it to you directly as well.
Thank you, because we actually can't see anything in the chat for some reason. I don't know if it's just my computer, but I'm not seeing anything.
Oh.
Yes. Okay. So I'll definitely make sure that they send it to you directly, Jaleesa.
Thank you so much.
You're welcome. Pretty neat. Any other questions? And I'm so excited that you're interested, by the way. We can't wait to see everyone at the training, which will fill up.
There is a question in the Q&A about, will there be CEUs? Now, do you mean for today or for the 4-part or the 3-day training? And the short answer is we will provide proof that you were here either today or at that 3-day training, and you can take it to the governing body that you want CEUs from and see, but we don't have any partnerships specifically at this time. Any other questions? see no hands raised. Okay. Well, next slide, I think has contact information for me. You can always reach out to me if you have other questions or need the link. It should be coming up here in a second. Next slide. There we go. There's my email address. Feel free to reach out to me with any questions or concerns that you may have. I will be happy to respond and get you any further information. And lastly, we'll say next slide and thank you. Thank you for being here. Thank you for participating in our polls. There is a survey you'll get on the whole webinar, and we would really appreciate your feedback. So please take just a couple minutes to fill that out, either today or in the next day or two, but we appreciate your feedback. So again, thank you to the Inclusive Healthy Communities and Department of Human Services Division of Disability Services for your financial support. We are very happy to be here and working with New Jersey. So with that, we will say thank you and have a great rest of your day.